Mina.
Good morning, everybody, the audience who are remotely connecting us, and to everybody here in person. My name is Mina Bhardwaj, and I'm one of the lecturers in the University of West London, teaching international health and global health. My background is quite wide. I studied bioethics and medical ethics with Darrell, and I'm also trained as a biologist and a public practitioner, but my degree was in public health medicine. So that's my background, quite wide. But at the moment I'm focusing more on international health. So you will see lots of pictures and data in my presentation today. But what I'm trying to do today is to link the role of food and nutrition with climate change. And based on the facts and the evidence, scientific evidence that we have as of today. So data is fairly recent. As of 2019, as regards to how climate change is affecting livelihoods of people and their nutritional status as individuals and communities across the world. So, as you'll see, my first slide please, next slide. So my talk basically will revolve around the role of agriculture, climate change, and food and nutrition, and health and well-being. Those are the three domains in which my talk is going to actually revolve around. And I'm not going to touch more on biocultural values, slightly, but not a lot. But it's more on research side of things and how food and nutrition is affected by climate change globally. So why nutrition is an issue as regards with climate change? Next slide. So there's a double burden on nutrition, for nutrition because of climate change. As we all know, coronavirus is already here, so there's an impact because of zoonotic conditions, because the conditions that are passed from humans to people. And coronavirus is a very recent example of that condition. And it could be because of your behavioral issues, or it could also be because of rising temperatures, because survival factor is there. If your climate or if your environment is not clean, and the likelihood of or propensity or the rates of spread of the disease is higher. The second is on the impact of climate change on food systems. So one is individual level, other one is systems level. How food security is being affected by climate change, and how food systems in themselves. Food systems I mean how foods are produced, how crops are laid out in the environment, how foods are produced until it comes to the plate on the dinner table. So the whole system is affected because of climate change. So there are two aspects of climate change that affect nutrition. Next slide, please. So the world is changing. As I said, there are challenges to agriculture, which we are quite aware of because of climate change and temperatures rising, and globalization. So I'm not going to go into much details. I think it's self-explanatory, a lot of things. We all hear about news and how environmental degradation has led to migration of communities across the world, as well as affected their health and well-being at individual and family level, and how world conflicts have affected their health as well. So the world is changing. How agriculture is impacted because of world conflicts, and particularly in parts of the world where agriculture always has been an issue, cropland always has been an issue, drylands. And then there are arising health threats. I've already touched upon the coronavirus, but there's a huge list of other conditions, as you can see, arising diarrheal diseases, malnutrition, chronic diseases, because of change in the food systems, if not environment per se. Next slide, please. Now, if you look at the graph, which talks about population of the world estimates, which is by 2100, from 2015 to 2100, the amount of what you call people that would be increased about, if you look at the graph very clearly, there is 95% prediction levels, means it is predicted that every single 10 to 20 years, the rise in population is up to 2 to 3%. That's basically the graph is saying. And by 2100, the prediction would be that you would have about, just about over 10 billion people in the world by 2100. So 95% prediction levels means confidence interval, means that's a confidence of today's population given the way reproduction is going. You would definitely have over 10 billion people by 2100. That's the, so when you say 95% 95% prediction intervals, means 95% of the confidence intervals by statistical values that you have, that you will definitely have over 10 billion people in the world by 2100. The statistics, don't worry too much about it, but that's what it means. All right, so next slide, please. So if we are going to have 2100, about over 10 billion people in 2100, how are we going to feed them? What amount of calories do we need to feed the world at that time by 2050? At least half of it, let's 50 years less by 2050. What amount of calories in the world do we need to feed people? How much food do we need? And as of from 26 to 2050, the required increase is about 69% increase we need to feed people. So how much cropland do you need to grow to produce that level of food for the people, about 10 billion people by 2050 or 2100? So if you say, if you have got 0% of agricultural production today, which is not true but hypothetically, if that's your null hypothesis that 0% is your production, you would need to increase it to by 70% in the next 35 to 40 years so that you can feed 10 billion people. So it's a huge, huge task. And where is climate going? Will climate be sustainable enough? Will we have enough of biodiversity by 2050 to be able to feed that number of people with that percentage of calories required? So that's the point I'm taking here. So I hope it is explanatory. Yeah. So next slide, please. Now we know that we need 70% increase in calorie production or crop production to feed 10 billion people. But as of today, about 28 to 29% of globally people are already part of agriculture community. It is growing less because people are migrating for jobs and other things or conflict areas. But as of today, you can say, or last 2-3 years, about 28% of the global population is directly or indirectly employed by agriculture. So it's 30% of the people who work in agriculture sector. They may not be farmers, but they're part of the food system. So if climate goes down, 30% of the people are at risk of their livelihoods as well. So it's a double or triple burden of diseases here because of malnutrition, climate change that we might have in the future. So basically that's the point. Next slide, please. So where the trends are, so is everybody going to be affected by that? Or who will be affected? Which part of the world would be affected? So if you look at the table here, it clearly says that undernourished people in millions in 2018 total number was 821 million people in the world who were malnourished in 2018, which is quite a dire figure. And it has not changed since 1999 when we worked in FAO, which was about 820 million people. So last 20 years, the figures have really not shifted. It's over 800 million people still hungry or malnourished last 20 years. And with climate going the route it is going, what impact it would have on people's nutritional status. So which part of the world do you think is going to be affected? The figures largely show, if you look at Africa, it says 256.1 million people were affected, followed by, in Asia, it's 513. So one might contradict and say like, actually Asia is going to suffer more. That's what the figures show, isn't it? 531.9 million versus 256.1. Yeah? So we will feel that Asian population might suffer more than African population. But is this true? No. Figures do not depict the proportion in terms of population versus the percentage. If you calculate the ratio of African population versus Asian population, obviously Asia has got larger population, so the death rates are higher. But proportionately, number of people alive versus number of people dead is lower. But in Africa, the population is comparatively less than Asia. So if you see half of the figure, if you compare African population versus the death in Africa, it is still higher. So number of Africa as a continent would still be more affected compared to Asia, although the numbers appear to be misleading. So you have to be slightly bit more critical of the way you look at the figures, then try to depict what it would mean for a particular continent or particular community or particular family or to individual level. So shall we move on? If anybody has got questions, please stop me if you're not understanding. Next slide is about, now we know that which part of the world would be most affected. Let's see what sort of biodiversity, soil biodiversity we have as of 2019. Now, if you look at the two maps together and where the threats lie, so African continent still has got the largest soil biodiversity as of 2016, which is just 4 years ago. In next 20 to 30 years, the loss of threat is highest in Africa as well, and the death rate is going to be, and as I said, proportionately there will be more deaths. So largest effect would be on African continent because of malnutrition and climate change together. So, and these are based on facts. So it's an interesting graphics they're talking about. Of course, you can see a lot of parts of Asia as well, but if you go back to my last slide where I said numbers are kind of misleading, same here. It says, Asia is quite red as well. You can see lots of Asia being quite red, but in terms of death rate, the effect will be more in Africa than Asia. Is it clear?
So why is it more threat to Africa?
Because lots of, if you see today's soil biodiversity map of soil biodiversity index in Africa, it's quite green at the moment compared to Asia. Yeah? Comparatively, I'm not saying it will be good. Comparatively. And as the proportion of people in Africa that die because of malnutrition is higher.
Yeah.
So if the loss of biodiversity is higher is proportionately will have more impact on death rate of people compared to Asia because they suffer from malnutrition anyway comparatively, and if they lose their agriculture plus loss of biodiversity plus malnutrition, so malnutrition rates are going to be more in Africa. That's what I'm trying to lead the story towards. Yeah? Any more clarification? Is it clear? Or
I would like to ask, there's a large-scale migration from Africa to Europe and other countries. So if you keep the background of migration, then the numbers may change. The prediction may be different because a lot of people would have moved out.
Well, not necessarily. Moved out to where?
To other countries.
So what impact it would have on the nutritional status?
The death rate may not be higher as you have predicted.
No, migration is one variable that you would look into statistically. Migration would have when you look at different variables, when you're calculating death rate, migration is one variable that you would look into. The impact on death is mortality rates, as we call them. The impact of migration is very minimal, because they're already suffering from underlying conditions when they migrate. They are not migrating as well, healthy, rich individuals. They are migrating because of other reasons, and health is one aspect of it. They are migrating because of loss of climate change. They can't grow their crops, so they have to migrate to urban areas or migrate to completely different countries. They already suffer from malnutritional conditions. Yeah. So, and then even if they migrate to, let's say, a lot of Syrian population migrates to Jordan or Lebanon or other parts of the world, North Africa, where that's the region where the majority of them would go to in the end, because it's culturally closer, it's geographically closer. The percentage of people migrating to Europe is still quite low comparatively. From Syria, Lebanon and Jordan are the countries and Egypt are the countries which have got the maximum people who are migrating from Somalia and other parts of the world. Europe comes into the news because of the media, but if you proportionately, the number of people migrating to, they won't have access. How would they migrate unless they cross the rivers? So they will try to settle down in those safer places which are closer to safe havens, which are culturally closer. So in terms of, as I said, migration is just one little. It won't have a major impact in terms of overall health status of migrants. Very small. And when they migrate, depending on each country's health system, they may have access to health, they may not have access to health. A lot of pregnant women in the UK who come with refugees, who have refugee status, die. Even in the UK, because they are refugee status, they don't have access to NHS many times. Maybe London possible, may not be possible in Liverpool, where I was based earlier. So migration, thinking that migration will lead to better lives, is not the reality. Actually, if you look at the health status of people, that's not necessarily the case. So, but we can have a discussion about it.
Yeah, we could perhaps discuss this later.
After
the paper is over, I would be glad to discuss that with you.
So let's move on, and then we can talk a bit more. So anyways, established status of soil biodiversity. So if you look at globally how annual forested areas are changing, one is soil biodiversity, another one is forests, right? Croplands versus forests. Again, if you look at the figures, the net rate in Africa is still quite high in Central Africa.
Is this the annual change in forest areas?
Yeah, annual change in forest areas is quite high. My focus is more on Africa because of my first point on why the death rates in Africa would be high comparatively to Asia, that the proportions of people dying. So I'm focusing more on Africa, and if I continue with my story of Africa, if you look at the graphics here, it says net losses over 250 to 500 million hectares of land in Africa would be lost due to forest and urbanization and climate change. Another one is China. You can see big greens there. But China is net gain. Green is for gain, not for loss. So it's contrasting stories there. All the pink and the reds are net losses. All net gains are in greens.
Does this include the 1 trillion tree plan?
Could be.
No.
Because of the government's initiatives, people are focusing on greenlands a lot, saving the biodiversity. And my last slide talks about which governments have got the plans for policies around climate change, which don't in relation to nutrition, but this shows that most of the African continent basically doesn't have any policies to save the land. So that's why their net losses are higher. So, shall we move to the next one? So, number of wild food species reported by type and region. I put this slide in this because you have seen the biodiversity loss, the projected biodiversity loss, and the annual loss of forests. Now, if you look at Africa, the number of wild species as of today available as food is still the largest in the world. So they rely a lot on nature for their food. I'm not talking about animal kingdom, I'm talking about plant kingdom only. So if you look at the green plants, Africa is the largest continent in the world that still relies on crop. And not even crop, but just food in nature. Compared to Asia, it's one of the largest ones, and then followed by Latin America more. Yeah? So the reliance on land and biodiversity is huge for food in Africa compared to the rest of the world. So there's a pattern emerging how how climate is going to affect the soil biodiversity, how it is going to impact the food requirements and food availability of people across the world. We can move next one to the slide. Okay, reported climate change related threats to biodiversity. Again, if you look at how much they rely on wild crops and food, the last slide showed. But climate-related change threats associated to biodiversity means it is going to impact on the food status as well. Africa and Asia still are highest. In terms of over 35% of the African countries are having threat related to change in biodiversity due to climate change. So more than 1/3 of the continent is actually going to wipe out in 50 years, 100 years time, if they don't do something about it as of last 2-3 years data. So I think that's basically what it is.
What does the x-axis represent?
Sorry?
The x-axis, is that represent years?
The x-axis represents the intervals between years.
Which would be roughly what?
10 years gap.
Each one is 10 years gap? Or?
Yeah, 10 years gap. So it's 2050 if you say. I can't remember which. I think it started from 2010 data. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So 2100. So because the target was 2100, some of the projections for calories needed were 2050, so 50 years less. But this one probably is again 2100. years or 10 years, 10 to 15 years of gap. So every 10 years is a generational gap, they say. So probably they could have used that interval of 10 years to project how 10 years are going to affect biodiversity every 10 years. Shall we move? Next one. Okay, by region, Asia is interesting because Asia is the one that is investing quite a lot on deforestation.
What do you mean investing on deforestation?
Well, people are doing deforestation a lot because of monoculture or having large farmlands or just because India and China have got huge populations to feed. What would they do if they don't cut the crops or they don't cut the forests? So those two countries altogether actually make up quite a huge chunk of deforestation. Although there are policies, as you have seen, it's going to go green again in 100 years' time because of people's movement or whatever the reasons could be. But as of today, they rely quite a lot on deforestation, which is not the case in Africa. If you see the yellow bar in Africa, it's quite small. So they are still relying on nature. They are not changing. Agriculture is small, but the reliance of hunting, feeding is quite a lot, comes from nature directly. So it's interesting. But if you look at the sky blue bar, what does it depict? It says overexploitation of nature in Africa. They are not cutting the trees down, but they are overexploiting the nature. So you can see Africa and Asia quite contrasting. One is focusing just cutting down and having lots of land for agriculture. Another one is they're not having agriculture production as much, but they're overexploiting what they have. It could be because of still Africa, it's my hypothesis, it could be because Africa still has quite a lot of subsistence farming. Because they have small pieces of land and communities grow there, but they overexploit it. And that's one reason loss of soil biodiversity is there, because they're overexploitation of the land, even if they're not cutting the forests. So, okay, shall we move? Next one. So now that was all about how climate is going to affect the continents. But we all know that everybody suffers from malnutrition, probably every continent, if not every person. Huge numbers, again in Africa and Asia. Asia suffers more from double burden of diseases, communicable and non-communicable diseases. This is generally known. And Africa is quite a lot of dark orange, means triple burden of diseases. And what does that mean to us? And what does it mean in terms of climate? I mean, we can link climate already, why it is happening, but triple burden of diseases are probably quite high in Africa, particularly South Africa and West and North Africa, quite a lot. So let's see how what the figures show. We know there's loss of biodiversity. We know they still rely quite a lot on land. Overexploitation is there, but they don't do agriculture as much as the Asians do. And this picture basically reiterates the same story, saying that impact of climate on food production would be quite high. So if you look at the bar, next one, impact of climate on food production slide. So if you look at the bar from percentage change in yields between present and 2050, so even if it is 2050, percentage of changes in yield is high in Africa, because overexploitation would mean they won't be able to even use the nature. Yielding does not necessarily mean actually growing, cropping. Yielding means extracting whatever is available in the nature, either through agriculture or just by whatever is available, extracting the stuff from nature. So it's still quite high in that part of the world, sadly. But so 3% of warmer world would have a big impact on the continent again. Shall we? Next slide, please. So how all are these linked to death rates in the world? If you look at, because we say if a mother is healthy, then the child is going to be healthy, the generation is going to be healthy. Yeah, she's the one who has to reproduce. The impact of climate change on maternal mortality rates is quite high because women suffer from undernutrition already. So if you look at the graphics, United Nations Child Mortality Reports, which shows that under 5 mortality rates of deaths per 100,000 live births. So per 1,000 children born in Africa, over 100 die. 100 to 150. Same shows for mothers. They die because during the childbirth. So if a lot of subsistence farming is there in Africa, where a lot of women are involved in cropping or doing hunting and, basically doing domestic duties of home, what impact it has on their mortality rates with the climate change happening. So you can see it's intergenerational loss of life in a way that you have maternal mortality ratios quite high and child mortality ratios equally high in Africa compared to Asia. So it's very similar sort of dark colors appearing in the continent between children and mothers. Okay, next slide please. Because we talked about double burden of diseases and Africa showing triple burden of diseases. So what does it mean? So communicable diseases, non-communicable diseases, what else? The dotted orange. Overweight, anemia and stunting. So a lot of women die because of infectious diseases during the birth or high child mortality. Child mortality rates are high because of malnutrition. But malnutrition is not only meaning that lack of food. The triple burden of disease also means overeating. So you have a combination of malnutrition, which means undernutrition or hunger, plus overweight, plus communicable diseases. So combination of those three is quite high in adult women in Africa, which means it would have a transgenerational effect. The point I'm trying to make is there's something called fetal parasitism, which means that when a woman is pregnant, she is carrying fetus in her body. Yeah. Fetus becomes a parasite. It is sort of a parasite because it depends on the mother to feed. Yeah. It has to survive the internal environment as well before it comes out of the womb. So what fetus does, if mother is not eating properly, either overeating, undereating, whatever the case may be, or not eating any nutritious food for whatever the reason, it becomes a parasite on the mother. Like it extracts extra just to be able to survive. And that gestational, if mother is eating, say, unhealthy food based on high carbs and high fat diet, fetus carries that genetic makeup when it is born. Maybe as clinicians you might know the word gestational diabetes. That's classic example of treble burden of diseases. Those African women who can afford good high-end food, like Western style, high carb, high fat food, they would probably have gestational diabetes issues more. On one hand, you have high mortality rates of women dying because of all sorts of things, including hunger and malnutrition. On other end, you have obesity-related conditions, and next generation actually carrying the same gestational conditions that are passed from mother to child when the child is born. So Africa again is one of the regions in the world where, as of now, it is suffering because of urbanization, whatever the reason, being Kenya and big countries of Nigeria, Kenya, Ethiopia, South Africa, those ones. If you look at, that was mother suffering from treble burden of diseases in Africa. What about children as of today? So if you look at global overview of childhood malnutrition, you can still say that obesity trends are increasing generally anyway globally for children. So Africa would definitely, because they usually have more children anyway, 5 to 10 children per family is a norm. So the percentage in Africa is going to rise in terms of treble burden of diseases as well. So next slide. So what it would have cost on governments? All these figures and data and this is 2020 paper in BMJ. Actually, I downloaded it yesterday or 2 days ago. And it showed the cost of health impacts on food systems would be in billions and trillions. So if you look at obesity figures, it's going to cost about $760 billion in terms of addressing obesity as an issue globally. $3.5 trillion for malnutrition. I mean, these are global figures, so I don't know particular continent figures at the moment, but the figures are in billions and trillions, whichever the food-related issue you are going to address. You need a lot of money to address both climate change and nutrition links between the two.
What do you mean by the 760 billion cost to health impacts? Is that to address obesity or
to address obesity as an issue, you would look not only at individual health consequences of an individual, like going through surgery or having interventions related to having healthier diets, for example. That's part of it. But how to change food production systems? There are lots of ways you can do it. Of course, you know taxation, sugar tax is there already. So taxation is one way of getting some costs out of the system. What other measures you would take? Whether it's a better urban, having more parks so that people walk, or you have more stairs, changing the environment we live in, infrastructure we live in. We are not dependent on technology so much. Either way, obesity as an issue is going to have a dual, looking at food systems plus the condition itself. So that cost is inclusive of all those measures. And malnutrition is probably the highest. No, it's the losses due to non-communicable, 7 trillion. So obesity is one non-communicable disease, but others are cardiovascular conditions as well that would be probably affected. That was systems cost, food systems cost, and what are the human costs. So these are just some figures from what are the environmental human health costs would be there. I think I won't go into much of the details of the figures. I think the previous one was more easier to understand, but it is again in billions and trillions. If you look at
Could you read through?
Okay, the current global food system is leaving 795 million people hungry as a system, and 2 billion people are micronutrient deficient. So it's how many? We have got 8 billion people on Earth, let's say, as of today. Average. The 2 billion are suffering from micronutrient deficiency. So practically 60 to 70% of the population in the world is suffering from some sort of deficiency already. And then it says many of the world's food systems are exceeding approaching planetary limits and are compromising the capacity of the planet to produce food. So these are talking about not monetary costs but human health costs. So human health means mortality rates are going to go higher. So yeah, rest of the things are even sticking to the global carbon budget means some regions will suffer devastating effects. So even if you stick to the global carbon budget, whatever the budget is today, even if there is a 2% rise above pre-industrial levels, means if there was no industry and there was just natural increase in the temperatures, not because of CFC gases, they would still have an impact on human health just because of the change in weather. So which countries do we have planned to include climate change in their nutritional plans and how? Next slide, please. Next slide. So countries with national nutritional report that includes climate change, so it's quite all the countries in the black, a lot of them
read them please?
Yes, I can read them. So a lot of countries are from Africa, which have included climate change and nutrition together in their health reports or have some sort of a plans to address, which are Gambia, Sierra Leone, Rwanda, Yemen, Nepal, Niger, Mali, Bangladesh, Madagascar, Ghana, Indonesia, Chad, Zambia. So most of the African countries' governments are aware of it. Well, not most, at least some of them are aware of that climate change and nutrition are quite interlinked. So they need to do something about it. But there are other countries that do not have, are again in Africa, like Kenya, Malawi, Mozambique, Senegal, Burkina. So it's divided. Africa is divided in terms of having nutritional policies linked to climate change. So it's kind of half and half, I would say, more or less. So next one, last slide, second last slide, legal and policy frameworks on agroecology. So countries that have implemented laws and regulations and policies in support of agroecology, these are the countries that have some sort of framework to improve their agricultural status and ecological status, but other countries don't. You can find the figures on agroecology, FAO's website, Agroecology Knowledge Hub. But there's a lot of countries in Africa who don't have any policy to improve their soil biodiversity frameworks yet. So I think South American continent is doing all right, but majority of the world is not doing that great. So they need to do something about it to help them.
So saying even USA and Canada seem to be oblivious.
Pretty much. Well, with Trump being there, he doesn't even recognize there is climate change. So what are you going to do if it comes for the next 5 years? He's not going to invest it. He came out of Paris agreement.
Yeah.
He doesn't recognize
You've
climate
got
change.
even UK not doing anything.
Not a lot. UK doesn't exist on that.
And China, which continues to be attacked in the press, seems to be doing a lot more.
Well, China is a mysterious story, so I wouldn't trust the figures from China as much. But it is because it's not transparent. I wouldn't say much more about it. It's not that.
So on this global map, the blue means what?
The blue ones are the countries that have got some sort of legal policy framework on agroecology.
A specific bit. Okay.
The others don't. Specifically on agroecology to improve the the agriculture side of things and ecological, so some sort of improving soil biodiversity programs, etc., etc., etc. Legally, not as interventions, but legal implementation. There's difference between having a program, policy, and a law. So those with specifically designed laws, India got huge amount of programs going on, but that's not legal, that's an intervention. So when you're talking about legal framework, it has to be bound in the constitution, right? If it's not bound, if it's just an intervention or a program by some funding, that's okay. But is it constitutionally binding? Probably no. It's just research-based programs, but in countries. That's what it depicts. The next one is climate change and malnutrition must be tackled together. Next slide, please. It's not my own. It's taken again from somebody who wrote a fantastic piece on this. It is by reducing red meat consumption. So countries need to have triple duty action. Basically, it is suggesting one is to focus on NCDs, other is on addressing climate change, and third one is to have undernutrition. Yesterday I was teaching public health nutrition to my master's student in the morning, and there was some data which I have not included, and it said that if you reduce the subsidies on meat production, it is going to improve the health of the people. So meat production, for example, farm chickens, or because farmers who are in animal husbandry get a lot of subsidies for them compared to farmers who grow plants. So if you reduce the subsidies given to meat farmers, it is going to have a huge impact on people's health, because meat is going to go expensive in the markets, and people probably may eat less of red meat, and that probably might help. So that's one of the way of having fiscal changes made in food production system to improve health of the people. Last but not the least, the ethics side of it a little bit. So intersection of human rights that comprise overarching right to well-being and well-being framework. So there is a well-being framework, right to not only health but to well-being. So health and well-being are two different. So if you don't know the differences, WHO 1948 definition would help everybody quite well. So right to well-being is you may be healthy, but it may not include your mental health and economic well-being. So if you include economic well-being and mental health as part of your health, overall health, that is a right to well-being. So it should include to have right to healthy environments, right to health, right to food, your rights of children, and cultural rights. So all these rights should be included. Particularly, I would highlight right to food and right to healthy environment as part of right to well-being. And given the figures that we have seen, I think for bioethicists and including myself, probably I would argue quite a lot for right to healthy environments, not only physical environment but natural environments as well. So I would stop there. Thank you very much for your attention.
Thank you. This is a pretty eye-opening.
Thank you. So any questions from you?
Yes?
I think we'll discuss the questions later.
Yeah. We now ask questions, yeah?
You can ask questions now, that's fine.
Discuss, yeah.
We were talking about the death rates. They were already, the death rate is already high in African countries, and since you focused your research on Africa, a lot of changes are taking place in Africa now. Although they are having a lot of problems, for example, Tanzania has got a president who is working very hard and changing all the old rules and concentrating more on agriculture and health and things like that. Some of the meetings that I attended in Religion for Peace, I met a lot of these presidents and high order people, and they were all working towards environmental balance and nutritional, increase of nutrition. So I feel the death rate will not increase.
Oh, I think that there are three different questions you're trying to raise in your topic.
I mean, that's why I said let us discuss
so I think there are
it later.
3
What we're
points.
discussing now, yeah. Go ahead.
Yeah. You said because the governments are doing some things, the death rates will not increase. So there are 3 parts within that phrase. The first part is, yes, they are doing something, but what the impact, how would you measure the impact of what they are doing and when? So when you measure death rates,
That is a big question.
yeah, so as somebody who works in the sector quite, so this is a process framework in which when you're doing monitoring and evaluation, let's say in this case nutrition, climate change and death rates, let's pick up those 3 points. Yeah, that's what you were trying to address. They're doing something about agriculture and you think and they're doing something about nutrition, so death rates may not increase.
Basically they are trying to eradicate poverty and
I understand that.
yeah.
So that's what I'm saying. So there are 3 parts to your question. First one is addressing the first point of my comment. It's not contradiction, it's a comment. Would be that when you're measuring impact of the programs that governments are doing, you measure them at a certain period of time. First is, so you have process, you have outcomes, and then you have impact. You can measure the outcomes of the programs within 5 years, yeah? But the impact is usually a generation difference. So statistically or economically, when you are doing classical mathematics, so yes, they may change, I agree with you, but when? The impact of, let's say even India, let's say example of India itself, forget Africa for a moment because we are more familiar with India. HIV rates in India. We have vertical programs for HIV, we have vertical programs for tuberculosis, yeah? We have vertical programs for addressing malnutrition in women in India. I work a lot with ashas in villages in India, really going to the villages and actually working with them to improve malnutritional status of women. So let's say, if you've got 3 vertical programs from Government of Impact, why WHO figures do not improve for the last 20 years?
There is a
That's my question to you.
there is an equal number of the population rate is growing very high in India.
But so is Africa.
So the both of them are on par. So one goes, the other one also
But
goes.
this is also true for Africa. The population rate is equally going high. African population rates are Nigeria. If you are talking about Tanzania, Tanzania is one of the countries which has got very high population growth rate. So if the population growth rate is the same analogy if you apply towards Africa, same issues would appear. Exactly same problems. If population growth rate is impacting India, you are saying population growth rate, not population itself, not number of people, but the growth rate. So if you're talking about population growth rate versus the number of people alive in that particular country are two different things. So if the population growth rate is same in Africa and same in Asia, then you are answering your question yourself.
No, but then I have my migration in my mind.
Yes,
a lot of migration from African countries.
Indeed, and I tried to answer that question previously. So yes, people from conflict regions of Africa move. Whether they are moving internal migration or is it external migration? Whether they are moving between within the countries or they, well, that's what the media says. But the internal migration within African countries is proportion is much larger than the external migration due to conflicts.
So there's a lot of xenophobia in South Africa now.
Xenophobia within for example, I was in Niger in 2019 May. I was in Zinda, and there we were working on a UNICEF project, and suddenly a case came that there's a Boko Haram, something has happened, and you have to leave. People from one village migrate to other. What would you call that?
Local migration.
Internal migration.
Okay.
Yeah. So the proportion of people moving internally is much larger than people leaving conflict zones and moving to Western world. So the proportion, what you're talking, the death rate, overall death rate of that country will include both the figures, not one. What you're looking at is in isolation of the overall death rate. So what we need to look at when you say the death rate would go down for which population? If you say those who are external migrants are there, their death rate would go down. Maybe. I'm just going to say maybe. Still a question mark. The reason being, as I say, the countries who are accepting them or not will have specific policies related to addressing the health needs of the people who are migrating in those countries or not. If the UK government doesn't have enough, UK is one of the countries which does not welcome refugees as open arms with France or Germany. One could be geographical isolation because we are an island. They are a continent. It's easy to migrate to those parts of the world compared to UK. It's quite possible. Geography plays its roles, and then our policies are different. So if Italian government says I'm going to accept 500,000 migrants from say Somalia, yeah, or from Mali, which is another conflict zone. I'm going to expect, we are going to accept those 500,000 people from North African conflict areas, and we will provide them shelter. What does that mean? Does it include taking care of their health as well? Doesn't happen in US when Mexican migrants they're held up in prison camps. Why? They're giving minimum one soap and towel. So if they die, governments will never put the pictures on television screens. Never. So yes, it's what I call your estimation is as it may be. I call this as logical fallacy. It is a logical fallacy because that is what is being projected. You are logically correct, but it is a fallacy. So your logic is absolutely right, but it is not based on numbers. So that's what I would. So you have to really isolate the one you are saying and say, where does it matter? So that's the case of logical fallacy.
Any suggestions on solutions?
Work on it. That's why you have one November meeting on COP26. So governments are working on that. Solutions would be, I think, I'm always I'm always from top, not top to bottom approach would work, honestly. In this case, you have to start from the ground.
From the soil.
From soil. Top to bottom will not work. It would have to be bottom-up approach, where the governments must ensure, like in India, for example. In India, you have cases of subsistence farmers dying, suicide rates, for all sorts of reasons. Crop is the last thing in their head. It's the economic burden that they carry to grow the crops and try to sell in the markets. That's so bottom-up approach. Yes, if you want to address biodiversity, you have to, for big countries particularly, like India, China, Nigeria, Tanzania, Ethiopia, South Africa, they have to start, can't have what top-down approach, what work. Because as we saw in Africa, most of them rely on nature. That's what figures show. So if that's what the figures, you have to address people, not policies directly. You have to talk to people. What do they need to not die of hunger or malnutrition or whatever? So I think the solution is, there are many. There are 5 or 6 approaches already being taken. Fiscal taxation is obviously one to address the non-communicable diseases. Taxations are put high. Sugary drinks, alcohol, you have to show your ID. All those small little interventions are already there, existing. Changes in the food systems is another one. And universal health coverage, UHC. Every person, that's what I like about it. Has its own flaws, but UHC in Sustainable Development Goals has its own merits. It at least on principle says that every single person should have access to basic medicine, regardless of whichever class, caste, community, religion, gender, color, race you come from. Every single person should have. Governments are having their own programs, insurance-based, non-insurance-based, whatever. It's up to governments how do they implement UHC in the countries. But Bangladesh is a good example. They are doing some fantastic work. So I would encourage, if anybody is interested, Bangladesh is a good example to it has its own flaws, but it's a starting point is not too bad to implement UHC in Bangladesh. So I think I should stop.
No, and then
Any students, if they have got questions?
yes, so students and professors, anyone on Skype would like to ask a question, please go ahead.
I just have a comment to make in the sense that I looked at the PowerPoint presentation.
Yes, Suma.
And I basically think that Africa, one of the biggest problems there is to do with water. The water crisis is very high, and it could be another factor for this death rate. If you look at the UN's estimate, they say that Sub-Saharan Africa alone loses 40 billion hours per year collecting water, just for children to drink, for families to drink. And there is a problem because of lack of clean water. It's not just water, but lack of clean water. So this is some comment that I thought I would make. By looking at the graph, I think water should be a big factor also in it. Thank you.
Yeah, I think you're absolutely right. Water is an issue in Africa, but when we are talking about food systems and agriculture, and not agriculture, but food systems and malnutrition alone, water is included in that. I don't have particular figures for water, but water, if you go onto the WaterAid website or Safe Water website, you will get a lot of figures and facts from those two websites to look into how water, what is the significance of clean water in terms of addressing the health needs of people in Africa. So if you're interested, I would recommend to go onto those two websites and have a look at that.
Also, I by the way should mention, in loving memory of Suma and Mina and my own dear friend Jaipur Zaria, who actually Suma was also introduced to bioethics through Jaipur.
Right.
So but he works a lot on ecology as well. So thinking then of the session that we're planning for the COP26 meeting and 23 meeting in Glasgow, the role of nature and diversity in public health, in the frameworks that you mentioned, one is the Agro-Biodiversity Knowledge Framework. And then at the end you mentioned legal mapping of laws. So what laws do we include as agro-biodiversity? You were looking at direct laws, of course there's some indirect laws. I was thinking, for example, of the countries which have adopted the framework on the plant genetic diversity, because that's much broader. That's one aspect. And another maybe land use restrictions on this conversion. So you mentioned in Asia the deforestation was much more rampant, but in Africa it was more focused on that one of the challenges was overuse of land. So we do have land zoning restrictions, which could be another way that even local communities, local government can be involved. So have you found any papers or reference that would give us a way to measure that?
I would recommend you to go to IFPRI website, IFPRI, and probably you would get a lot of documentation from there. If you're interested, that focuses quite a lot on agroecology and land use and those sorts of. The IFPRI website is, and those who are interested can also look into the concepts around One Health.
What is One Health? Please explain.
That will take another whole day for me, but briefly, One Health is about, it's a concept, it is a concept that talks about how human is part of nature and it's not anthropocentrism, it's more about biocentrism, where human is part of nature and how nature, human and human activities actually impact health. Not only human health, but also environmental health. So when I started, I talked about zoonotic conditions. That's one of the classic examples of One Health, where focus has been, because livestock can pass a lot of conditions to human beings. So livestock production, it goes all what sort of agriculture you do, what sort of diseases can be passed from animals to humans, and how you can reduce those sort of zoonotic conditions that are an emerging threat to health, human health. Look into One Health as a concept, and there's a huge amount of research going in public health on and international health on One Health.
So if we think of zoonotic conditions, I'd also think of positive roles of animals. So for example, having a cat in the house is meant to improve your immune system as a child, is that right? Or exposure to cats and dogs?
Well, I don't know, I don't have data around that. I'm a very data person, so I can't talk hypothetical. But there may be, because that's why they say if you're exposed as a child, you build your immune system, so your antigens and antibodies are built up, so you have a better immune system if you're exposed to soil more. So we used to say, just go and play in the soil, it's alright, don't feel dirty, and you will be okay. Your immune system will be better. Maybe there is something about cats as well, I don't know. But it depends how clean the animal is.
But in fact, I'm saying the hygiene hypothesis is saying that dirt actually builds up your immune system, so that's fine. And what about the positive effect of hearing birds in the morning?
I think that's more psychological.
So that's part of well-being?
That is part of indeed well-being. Well-being includes both mental health and other kinds of health. Well-being is not only about physical health, it's also about mental health. And anything that improves your mental health, be it hearing birds in the morning, to you taking walk on the wet grass in the morning, to listening to say some hymns in the temple, whatever makes you feel better. It's up to you. It doesn't have any particular intervention. It's very individual, it's very personalized, but my only comment is that it is important and to give a break to your brain. It's very, very important. Just don't do anything for a couple of minutes. Don't think much and just try to de-stress, whatever makes you feel better, except food. Too much eating won't help.
So it was interesting in the slide of a number of wild food species reported by type and region.
Yeah.
You mentioned in North Korea, this is the data from the State of the World's Biodiversity for Food and Agriculture.
Yeah.
In North America it was less than 20%, 18%. Whereas in Africa it was 82%. And in Europe about 50%. So this means we go and eat wild food species or does it mean the food that we can find in the supermarket is also coming from wild food species?
It can mean both. In US probably because there's a good tradition of monoculture. So anything that wild food species people eat does not necessarily mean that it is grown in the US. It can be imported. So wild food species does not necessarily mean that it has been grown in the part of the world. In Africa it is mostly grown within the region compared to US. So I think that difference has to be remembered, but where it is grown, where it's eaten.
Locally grown is much more healthier than
Definitely, locally grown is better than imported. But you can't find every type of wild food species in UK, but you eat all sorts of wild. I mean, wild mushrooms are very expensive. If you go to supermarkets, if you go to supermarkets in
thousands of miles and they come here.
Yeah, so I love eating mushrooms, but if I want to eat wild mushrooms, they're super expensive.
You have to grow your own then.
Sorry?
You have to become wild and then you can grow your own.
You can pick your own. So there are different ways of what constitutes as wild species. You need to deconstruct what it means. Yeah.
Do we have some other comments or questions from different perspectives? So in terms of the event, I guess through the day we need to think about what aspects would be attractive to people, because I think and how to fill the gap, because I think nature and diversity from the perspective of public health, as you said, you focused on some of the ones which you think you have the statistical data to support the association with health. That we also have roles of nature and diversity. The religious aspects would also be interesting.
The ladies there, just going to talk about.
Later presentation. Walter will have a later presentation. And that'll be good to integrate as well.
So mine was very hardcore fact-based.
No, a lot of data. You worked on a lot of data. I mean, I appreciate it because to get a global data like that and then work on it, it's really put on a lot of effort. Good job.
Yeah, thank you. Well, it's a story based on just facts and figures.
Thank you very much.
Thank you for the questions, and I really enjoyed it. Thanks a lot, everybody. Thank you.
In the coronavirus, as opposed to, as opposed to adults only, because it does appear that only adults and older folks and those who have underlying conditions are much more affected now than children. It hasn't been reported much of children being infected at all. So I want to know what is the probability or the propensity for that.
Yeah, I can try and help with that. I'm Jeevan, one of the local GPs here.
Yeah.
I think it's the same with any other kind of common virus. If you've got lots of comorbidities, if you're frail, for example, if you have pre-existing conditions, you're more likely to be susceptible to these conditions, and coronavirus is no exception. It doesn't have very high mortality rates in the young or fit and well, and most of the people actually that we know of in the data in the West that have passed away have had pre-existing conditions. So I don't think it's particularly unusual or unexpected. And I mean, some figures are reporting mortality rates similar to that of influenza, or maybe slightly higher. So in that sense, the reason why we don't hear much of deaths in young people is precisely because of that. Most of us will have kind of mild or limited symptoms, and it's usually self-limiting. So I think that's the likely reason why you're not hearing much in the news about young people with coronavirus.
Is there another aspect is also the microbial diversity? I mean, we have around 100 microbial species in our body.
More than that.
More than that, yeah. And like 18 are found in every person in the world, 18 ubiquitous microorganisms. So that's also an aspect that nature and biodiversity could be in health.
Gut microbiota is very important.
Yeah, so they're finding a lot more data. The microbiome affects mental health, physical health, risk of various conditions. So yeah, I think there's still a lot of research to be done. So it's quite an interesting topic, the microbiome and health.
Yeah, gut microbiota is a big topic these days for researchers, particularly as regards with genetic susceptibility. And also to top up what you just said, I think you're quite right. And also it depends on, because we have comorbid conditions for adults that result in actually death. I was watching CNN yesterday and they said the fear of coronavirus is there, and quite rightly so. But and the fear is not because it is deadly. I mean, Ebola is more deadly than coronavirus, for sure. Ebola, but nobody is talking about Ebola these days. Everybody is talking about coronavirus. Why is that?
It's new.
It's new. It's
sexy,
exciting. It's
from China.
and it has a cultural aspect to it. You see, it has a cultural aspect to it because it's a zoonotic condition, just like SARS. So they call it as a brother of SARS, really. In H1N1 basically. So there's a cultural connotation attached to the way it was originated, and then it got spread out to humans.
But coronavirus, this word term is not new. It's been there long time. I think people have been using this word very often, but it has become.
It's not about the use of the word. The coronavirus exists. We all have probably had coronavirus, different strains.
Yeah.
This
is a novel strain of coronavirus.
Yes, because it's a zoonotic. It has become a zoonotic condition now. It has come from some species of animals. Some people say bats, but I doubt it. But there is no evidence that it originated from a meat market in Wuhan. Which meat it came from, nobody knows yet. So it's
the type of food they eat.
Again, that's a cultural thing.
That's why I'm saying it's a cultural connotation attached to it, and that makes it a bit more. It has its own what you call superlative consequences of the disease, but a bit more wider, sadly. But that's the way it is.
Yeah. Well, thank you.